Hello everyone, I am going to detail about Bacillus cereus. General characteristics: gram-positive bacteria, rod-shaped, motile in nature, capsule absent, spore formation found, and respiration is aerobic and facultative anaerobic. Temperature is 30 to 40 degrees Celsius. pH is 4.5 to 9.3. Habitat: it's not considered as a normal flora. Bacillus cereus isolated from soil, milk, cereals, etc. It's also not easily killed by alcohols. Bacillus cereus first isolated by Grace Franklin from air in cowshed. Pathogenicity of Bacillus cereus. Disease transmission. Primarily transmitted by ingestion of Bacillus cereus contaminated food. Emetic type of food poisoning associated with consumption of rice and pasta. Diarrheal type mostly transmitted by milk products, vegetables, meats, and etc. It also forms spores and spreads easily. Incubation period. Incubation period is 1 to 6 hours. Virulence factors. Virulence factors is classified into 5 types. First is enterotoxin. Enterotoxin classified into 4 types. First, emetic form, diarrheal form, hemolysis, and finally cytolysis. The second virulence factors is necrotic toxin and cereulin, phospholipase, finally collagenase. Pathogenesis. Bacillus cereus is causing food poisoning. Food poisoning is classified into 2 types. First, diarrheal syndrome and then emetic syndrome. It results from production of enterotoxins in gastrointestinal tract. The dosage of ingested Bacillus cereus spores leading to diarrheal syndrome is 1.5 to 1.7 gram of ingested food, and for emetic syndrome is 1.5 to 1.8 gram of ingested food. Diarrheal syndrome are unresistant to the acidic conditions, but the emetic syndrome is more resistant to the acidic conditions and remains active at 121 degrees Celsius. Its cause foodborne intoxications has been reported to cause local and systemic infections. Also cause ocular infections by Bacillus cereus. Clinical diseases caused by Bacillus cereus. Gastroenteritis. Gastroenteritis is have majorly 2 types. First one is emetic form gastroenteritis. Emetic form gastroenteritis implicated food is rice. Incubation period is lower than 6 hours. Symptoms are vomiting, nausea, and abdominal cramps. Duration is 8 to 10 hours. Emetic form gastroenteritis enterotoxins are heat stable. Diarrheal form gastroenteritis. Implicated food is meat and vegetables. Incubation period is higher than 6 hours. Symptoms are diarrhea, vomiting, and abdominal cramps. Duration is 20 to 36 hours. And finally, enterotoxins are heat liable in nature. Ocular infections majorly have 3 types. First one is keratitis, and second one is endophthalmitis, and finally panophthalmitis. Severe pulmonary diseases. Bacillus cereus can also cause severe pulmonary diseases. Laboratory diagnosis of Bacillus cereus. Microscopic examinations. Gram staining. Violet colored gram positive rods in singles, pairs, or serpentive with square ends. Motility test. Motile in nature. Endospore staining. Green colored endospores and red colored vegetative cells present. Colony morphology on culture medium. Nutrient agar. Large, feathery, spreading, dull, grey, granular, spreading colonies, and opaque with a rough matted surface and irregular parameters. Blood agar. Bacillus cereus shows beta hemolysis. Mechanic agar. White colored non-lactose fermenting colonies found. Peacock blue colored colonies found in Bacillus cereus selective agar. Biochemical test. Catalase test positive. Oxidase test negative. Urease test negative. Indole test positive. Methyl rate test negative. Vogus Praskar test negative. Citrate utilization test positive. Nitrate reduction test positive. Gelatin hydrolysis positive. Casein hydrolysis positive. Arginine dehydrolase positive. Yoselin hydrolysis positive and lysis by gamma page negative. Antibiotic therapy and prevention of Bacillus cereus. Oral rehydration, intravenous fluid, and electrolyte replacement for patient with severe dehydration is indicated. Antibiotics are not indicated. And ocular infection is treated by using clindamycin, erythromycin, vancomycin, amylocytes, and tetracycline. The best prevention of disease from Bacillus cereus is proper cooking of food, refrigeration of food materials. By N. Madan, first MSc Applied Microbiology, Sacred Art College. Thank you.